Now we are going to see some general questions from part 7. What are the signs of opioid toxicity? If a person experiences opioid toxicity, what are the signs he exhibits? He will have CNS depression or central nerve system depression, papillary meiosis, respiratory depression, or cyanosis and bradycardia. ഒപ്പിയോയിഡ്സ് ടോക്സിസിറ്റിയിൽ ആ പേഷ്യൻറ്റിന് CNS ഡിപ്രഷൻ ഉണ്ടായിരിക്കും, റെസ്പിറേറ്ററി ഡിപ്രഷൻ അല്ലെങ്കിൽ സിനോസിസും ഉണ്ടായിരിക്കും, ബ്രാഡികാർഡിയ ആൻഡ് പാപ്പിലറി മയോസിസ് ഉണ്ടായിരിക്കും. And according to the post-registration education policy in the UK, if a registered nurse wants to observe chest insertion, what she should have an informal training. ഇൻഫോർമൽ ട്രെയിനിങ് കിട്ടിയിട്ടുള്ള ഒരു രജിസ്റ്റേർഡ് നേഴ്സിന് മാത്രമേ ചെസ്റ്റ് ഇൻസേർഷൻ ഒബ്സർവ് ചെയ്യാൻ പറ്റത്തുള്ളൂ. അക്കോർഡിംഗ് ടു ദ പോസ്റ്റ് രജിസ്ട്രേഷൻ എഡ്യൂക്കേഷൻ പോളിസി ഇൻ ദ UK എന്താണ്? എ പേഴ്സൺ ഹു ഹാവ് ഡെഞ്ചേഴ്സ് ദേ മേ ഹാവ് സം ഡിഫിക്കൽട്ടീസ്. സോ വാട്ട് ദേ വിൽ എക്സ്പീരിയൻസ് എ പേഴ്സൺ വെയർ ഡെഞ്ചർ കണ്ടിന്യൂസ്ലി ഫോർ ലോങ് ടൈം. They may experience signs. They have some patches which are shiny redness, and these patches will be in the tongue, cheek, palate and in the gums. So these are the kinds of patches. And how do we do a wound assessment? We should look for the tissue and any signs of infection and moisturization of the skin, and the edges should be look on tissue. Signs are infection, moisturization, balance of skin and edges on tissue. If a person experienced depression, how he will have changes and what kind of changes and what he will have. He will have the changes like physical changes, emotional changes, behavioral changes and finally cognitive changes. And if a person who recently had a fracture or he need to use a Zimmer walker, when the doctors have asked to us to take the measurement, and for Zimmer walker, how we'll take the measurement? We will measure the height of the person. First you need and then subtract 6 inches from his height. And how we measure for a Zimmer walker? When the patient is using Zimmer walker and free, he should affect the leg first and then he could use the unaffected leg, and first affected leg and then unaffected leg. We will see a patient who has depression. He has been advised to take AMI treatment. So he said that this is not effective. He is being worked for 1 or 2 days and it's not effective. It's convinced that the medicine will take 3 to 4 weeks to act. Then the fruits which are rich in antioxidants and tomatoes, broccoli and carrots. Most of you know CVP measurement. In CVP measurement, what kind of pressure? In the CVP, mainly check the right arterial pressure comes in CVP. And next, in the last class, we learned about the protective meal time. What is the purpose of protective meal time? Why we are giving this protective meal time for the patient? So we know that we should give adequate time for the patient to eat without distracting them. Okay, and so why we are giving this? We are providing a conducive environment for the patient to enjoy the food. That's why we are providing a conducive environment for the patient to enjoy the food. That's why we are providing conducive environment. And we are going for vaccination program in the community area along with some student nurses. Okay, and can we allocate the student nurses to give this vaccination? And actually we are not supposed to do that. Okay, and next is body mass index, BMI, body mass index. The values of body mass index, BMI. So if a person's body mass index is less than 18, he or she is underweight. How much? And less than 18 is underweight. If a person's BMI is 18 to 20 is normal weight. Between 18 to 20 is normal weight. And 21 to 25 comes moderate. 25 to 30 is overweight. and more than 30 is obese. These are the qualifications of BMI. Okay, and so according to the patient saying that BMI is 25, which category is coming under? It's coming under overweight. And then what are entry-coated medications? Entry-coated medications which has some oral medication in it, which allow it passes through the stomach and it will get absorbed into the intestine. Example, ecospirin. It's an entry-coated medicine. ഈ മെഡിസിൻ അബ്സോർബ് ആകുന്നത് ഇൻഡസ്റ്റൈനിലാണ്. ഇതിനൊരു കോട്ടിംഗ് ഉണ്ട്. ഈ കോട്ടിംഗ് സ്റ്റൊമക്കിലൂടെ പാസ് ചെയ്തു പോകാനാണ്. ഈ കോട്ടിംഗ് വേറെ എവിടെയും അബ്സോർബ് ആകില്ല. So, ecospirin is used in this case. And what is the minor disorder experienced during pregnancy? They are pelvic ache, backache, headache, and incontinence and constipation, tiredness and faintness. Then she may have bleeding and cramping. She will have deep vein thrombosis. And next we'll look on what are the causes of constipation in elderly people. Why elderly people have constipation may be due to their lack of exercise, lack of fibrous food, emotional stress and lack of fluid. These are the main reasons for constipation in elderly people. And then who will be accountable for Aaron's action? ഒരു ആറിൻ്റെ ആക്ഷനിൽ ആരൻ ചെയ്യുന്ന കാര്യങ്ങൾക്ക്, അതായത് ഒരു രജിസ്റ്റേർഡ് നേഴ്സ് ചെയ്യുന്ന കാര്യങ്ങൾക്ക് ആരാണ് അക്കൗണ്ടബിൾ? നമ്മൾ കഴിഞ്ഞ ഡേയിൽ പറഞ്ഞിരുന്നു അക്കൗണ്ടബിലിറ്റി എന്താണെന്നുള്ളത് ഡീറ്റെയിൽഡ് ക്ലാസ് ഉണ്ടായിരുന്നു. ബട്ട് ആരൻ ചെയ്യുന്ന എല്ലാത്തിനും അവർ തന്നെയാണ് അക്കൗണ്ടബിൾ ആയിട്ടുള്ളത്. ഓക്കെ, ഹി ഓർ ഷീ ആൻഡ് അവർ തന്നെയാണ് എന്ത് കാര്യം ചെയ്താലും അതിന് അക്കൗണ്ടബിൾ ആയിട്ടുള്ളത്. And then convert drug administration. Drug administration is where a patient continuously refuses to take some medication, but he doesn't know what is the consequences of refusing this treatment. Like if the patient is refusing to take chemotherapy, radiation therapy, but he doesn't know what will be the end effect. If he refused to take it, and this convert drug administration should be necessary or appropriate each. And when a patient continuously refuses the treatment and not aware of the consequences of this refusing the particular medication like radiotherapy and chemotherapy, ഒരു പേഷ്യൻറ്റിന് കണ്ടിന്യൂസ്ലി മെഡിസിൻ റെഫ്യൂസ് ചെയ്യുവാണ് ഒരു പേഷ്യൻറ്റ്. പക്ഷേ ഇയാൾക്ക് അറിയില്ല ആ മെഡിസിൻ റെഫ്യൂസ് ചെയ്യുന്നത് കൊണ്ട് എന്തൊക്കെ കോൺസിക്വൻസസ് ആണ് വരാൻ പോകുന്നതെന്ന്. സോ ഇതിനെയാണ് നമ്മൾ കൺവേർട്ട് ഡ്രഗ് അഡ്മിനിസ്ട്രേഷൻ എന്ന് പറയുന്നത്. Now, breastfeeding. Breastfeeding can help to prevent infection. If we breastfeeded a baby, we'll get some protection against infection. There may be a question, or what are the benefits of breastfeeding? So, it prevents infection. If a newborn baby is not crying and saying, you need to immediately and notify to the hospital. And why do we use saline food dressing alignment? It does not make major tissue damage less damaging. Thus, why we are using this saline food dress. If a patient has a heart failure, what she will experience? He may or she may have some inspiratory crackles on the lung base. Areas to consider on decision making for safeguarding. Who, what, when. സേഫ്ഗാർഡ് മേക്ക് ചെയ്യാൻ ഏതൊക്കെ ഏരിയാസ് ആണ് നോക്കേണ്ടത്? അതായത് 3 ഏരിയാസ് മെയിനായിട്ട് നോക്കുക. ഹൂ, വാട്ട്, വെൻ. ആർക്ക്, എന്തിന്, എവിടെ എന്നതിന് വേണ്ടിയിട്ടാണ് സേഫ് ഗാർഡ് മേക്ക് ചെയ്യുന്നത്. ആൻഡ് ദെൻ നെക്സ്റ്റ് വി ആർ ലുക്ക് ഓൺ ദ heart rate for 1 to 2 years old. The normal heart rate for this should be 80 to 130 beats per minute. And the next is environmental milieu. Environmental milieu is a fostering therapeutic, cultural, social and physical environment. എന്താണ് milieu environment? It's a fostering therapeutic, cultural, social and physical environment. Next, if a person has severe bleeding, how the skin will look? He will have moist skin and bluish nail buds. He will have cyanosis on the nail and moisturized skin. Next, how to collect urine samples? First, we need to cleat it with clean with soap and water and then catch the mist from urine. Then immediately transfer the sample to the laboratory within 24 hours and ask for the void remaining during the bedpan. Okay, if a patient wants to climb the stairs and the patient is walking ahead, how this person has to climb the stairs and how to descend the stairs. So, while ascending, the person has used an affected leg, and while descending, he should use the unaffected leg. Then what is supportive communication? Supportive communication is the face-to-face process of interaction that focus on advancing the emotional and physical well-being of the patient. What is that? Face-to-face process of interaction that focuses on advancing emotional and physical well-being of the patient. What is the concept of culturization? A culturization is a group of people who share the same characteristics in a group where they are belongs to. Next, after the liver biopsy, the patient is supported to be lying which side? It should be on the right side. What is equality? Providing communication aid to the patient with disability is what equality. And the next is false statement about abuse. When can a false statement about abuse happen? It can happen where there is a vulnerable person. What is the complication? Intrathecal or epidural anesthesia. The answer is meningitis. Answer is meningitis. If the patient has acidosis, what kind of medication the doctor will prescribe? Doctors will prescribe bronchodilators for a patient who has respiratory acidosis. If the patient is hyperventilating in order to prevent respiratory alkalosis, what is a registered nurse should do? She should ask the patient to do deep breathing exercise, and if the patient has a daily gastric treatment along with potassium chloride infusion, what a nurse should do for this patient? She should monitor the intake and output, as there will be a chance for hyperkalemia. And the next is, what is the complication of hyperkalemia? If the patient had hyperkalemia, what will he experience? He will experience muscle weakness. The patient has muscle weakness and he has hyperkalemia, and so we should use potassium sparing diuretics. For example, spironolactone. Spironolactone is a potassium sparing diuretic. In which kind of disease the patient has fine and silky hair? If a patient has fine and silky hair, it will be hyperthyroidism. It's not because of aging process. If an older adult has loritotrus yellow nails, whom he should consult? He should consult a chiropodist specialist of nails. In digeriatic wall, which kind of patient will prompt for skin breakdown? If the patient who has incontinence of PCS prompt to have skin breaking. And then what kind of wound is pressure sores? About the wound healing process. Pressure sores are the type of wounds that will heal by secondary intention. What do you mean by this secondary intention? Why it will called secondary intention? Because it's not have woundages and it start to heal from the insides. These kinds of wounds are called pressure sores. If you have a wound which is in the inflammatory stage and is progressing to the infectious stage, how it looks like? Or what are the changes happening to the wound from inflammatory to infectious stage? അതായത് inflammatory stage, the wound is yellowish discharge and in the infectious stage, the discharge will become purulent yellow in color and then it will become green in color and then tan in color and then it will goes to the brown color. In the inflammatory stage, the wounds is yellowish discharge and in infectious stage, the discharge will become purulent yellow in color and then it will become green in color and then tan in color and then it will goes to the brown color. After a wound irrigation, how the nurse should be dry the wound? The nurse should dry the wound by using one gauze pad in each swipe and one swab വെച്ച് ഈച്ച് സൈഡിലേക്കും ഒരു സ്വൈപ്പ് അത് മാത്രമാണ് ചെയ്യേണ്ടത്. അല്ലെങ്കിൽ അവിടെ കണ്ടാമിനേഷൻ ഉണ്ടാകും. An older adult with a skin tear on the flora, what dressing we should use? We should use transparent films, serum level of epinephrine, increased body temperature by producing heat. അതായത് epinephrine causes vasoconstriction. This causes stimulating and increasing metabolic rate, which will increase the heat production, and that is increase the body and it will increase the body temperature also. If the patient has pyrexia, what is the registered nurse's intervention? She should use direct fan therapy. What are the nursing interventions of pyrexia? He should prescribe antipyretics and indirect fan therapy are the nursing interventions for pyrexia. What are the prescribed antipyretics and indirect fan therapy? Direct fan therapy and tip inspentine should not be given to a patient if the temperature is continuously increased. Direct fan therapy and ടിപ്പിൻസ്റ്റെപ്പൻഡൈൻ ഒരു പേഷ്യൻറ്റിൻ്റെ ടെമ്പറേച്ചർ ഇൻക്രീസ്ഡ് ചെയ്യുമ്പോൾ കൊടുക്കാൻ പാടില്ല. ബിക്കോസ് ഇത് പേഷ്യൻറ്റിനെ ഡിസ്ട്രെസ്സിലേക്ക് കൊണ്ടുപോവുകയുള്ളൂ. സോ വി ഷുഡ് നോട്ട് പ്രൊവൈഡ് ഡയറക്റ്റ് ഫാൻ തെറാപ്പി ആൻഡ് ടിപ്പിൻസ്പെൻഡൈൻ. If the patient have increased temperature, what are the noticeable changes in hyperthermia? During hyperthermia, we will have shivering, vasoconstriction, increased temperature and increased excretion of carbon dioxide. During hyperthermia, patients will develop acidosis. Low grade fever will be normal to 38 degrees Celsius. Why will have mild infection, allergy after a surgery or a malignancy? You have low grade fever. So low grade fever will be normal to 38 degrees Celsius. Why we will have low grade fever? You have allergy, malignancy, mild infection or after surgery. You will have moderate to high. It will be 38 to 40 degrees Celsius. 38 to 40 degrees Celsius. If you have wound infection or UTI, you will have moderate to high temperature. And next is hyperpyrexia. Will above 40 degrees Celsius, you will have bacteremia and you have high pyrexia. If elderly patient has moderate hypothermia, and what a registered nurse should do? She should program a reheating device to register the temperature increasing 0.5 to 1 degree Celsius per hour. So, if elderly patient have moderate hyperthermia, what a registered nurse should do? She should program a reheating device to register the temperature increasing 0.5 to 1 degree Celsius per hour. ഇത്രയുമാണ് നമ്മൾക്ക് ഈ ഒരു സെഷനിൽ ഡിസ്കസ് ചെയ്യാനായിട്ടുള്ളത്.